the topic that I explored was the perception of risk during public health emergencies and its impact on behavior. So my purpose was to explore how people's beliefs change as a result of the COVID-19 health crisis using the so-called mismatch index. And I used India as my first case study. So COVID-19 represents an interesting case study for examining people's beliefs and reactions to such critical events. And in particular, not only people's own beliefs, but also their beliefs about others. So I focus on one particular measure of such beliefs, and it's called mismatch index. And it represents the average of the disagreement in personal beliefs and what people think others are thinking or how careful others are. So it is based on responses to questions such as how important is it for you to take actions to prevent the spread of COVID-19, or how important do you think it is for others to take similar actions? So it's individual minus societal. And they're measured on a scale of 10 to 100, where 10 is not important at all and 100 is extremely important. And the mismatch index is calculated by subtracting individual minus societal, because on average, every individual believes that they're being more careful than everyone around themselves. So I used variables such as age, gender, education, country, state, and time period to ensure that it's not a homogeneous data set. And my time period was divided into 2-week intervals, starting from June 2020 to March 2021. So these are the main takeaways from my analysis. This chart plots the average mismatch index of India over time, and the peaks have been circled. And when it was calculated for India across temporal and geographical zones, these were the results that were yielded. And there were 2 distinct waves of COVID-19 around May 2020 and March 2021. And these were the times when people were relatively cautious. There was high risk. And you can see that that's when the mismatch index was the highest. And when people started, when there was lower case rates and people started going more out, like getting more outgoing, that's when the mismatch index dropped. But I also wanted to study the relationship between case rates and mismatch index, like outside of just this data. So I wanted to see if there's other characteristics. So one qualitative observation was cross-state heterogeneity. And when compared across different states in India, more developed states, let's say due to urbanization or education, had a higher mismatch index compared to less developed ones. And this was interesting and an anomaly. So when I looked more into it, it was because the more urbanized you get, the less there is a sense of community. So there's less trust towards each other. And if you're less developed, then your community is smaller, and that's when you gain more trust towards each other. Obviously, like there were several anomalies. For example, there's Kerala, which is a very educated state, and it was the first to tackle COVID-19 in India. So education does trump all of that. And currently, I am exploring surveys done across states in America to understand people's perception of the pandemic. And I am doing so through data collection of questions such as how comfortable they are taking the vaccine, whether they're willing to wear masks, whether they're willing to take public transport. And I plan to explore the correlation between these factors and how that is going to affect people's perception of risk and their behavior in future emergencies. So thank you.